Opioid crisis, 100-word letter blame for causing widespread, deadly addiction. President Donald Trump on Thursday declared the country's opioid crisis a national public health emergency. "Nobody has seen anything like what's going on now," Mr. Trump said. Between 2000 and 2015, there were more than 500,000 deaths related to opioid use. According to a provisional report from the Centers for Disease Control and Prevention, CDC. Opioids killed more than 60,000 Americans last year, almost double the number of deaths in 2015. Today, about 1 in 133 Americans were estimated to have a drug addiction. A single letter by Boston University Medical Center physician Herschel Jick and his assistant Jane Porter. Addiction rare in patients treated with narcotics, published in the New England Journal of Medicine in 1980, has been blamed by researchers for the ensuing crisis. President Donald Trump declared the opioid crisis a national public health emergency last week. Picture, Evan Vesey, AP source app. Recently, we examined our current files to determine the incidence of narcotic addiction in 39,946 hospitalized medical patients who were monitored consecutively. The letter read: although there were 11,882 patients who received at least one narcotic preparation, there were only 4 cases of reasonably well-documented addiction in patients who had no history of addiction. The addiction was considered major in only 1 instance. The drugs implicated were imipridine in 2 patients, Percodan in 1, and hydromorphone in 1. We conclude that despite widespread use of narcotic drugs in hospitals, the development of addiction is rare in medical patients with no history of addiction. Inaccurate representations of that 1980 letter led to a dramatic increase in the prescribing of opioids for chronic pain. According to an article published earlier this year in the same medical journal by Dr. David Ehrlich of the University of Toronto, who researches drug safety. In a conversation with NPR earlier this year, Mr. Jick said he completely regretted that the letter fed the current crisis. "If I could take it back, if I knew then what I know now, I would never have published it," he said. OxyContin, Dioroxik and Liscontin are opioids. Drugs are being widely used in the United States. Picture, Josh Wanning. Source News Corp Australia. Vice President of Behavioral Health Services for Illinois-based Chestnut Health Systems, Joan Hartman, who has been working in treatment for 3 decades, said in all the years she's worked in the substance abuse field, she's never had so many patients die. There were fewer than 3,000 overdose deaths in 1970, when a heroin epidemic was raging in U.S. cities. There were fewer than 5,000 recorded in 1988. Around the height of the crack epidemic, more than 64,000 Americans died from drug overdoses last year, according to the U.S. Center for Disease Control and Prevention. This epidemic started around 1995, kicked off by a drug called Oxycontin, which, like heroin and morphine before it, was meant to be a safer and more effective opioid. Oxycontin and competitor drugs were designed to release the medication slowly over long periods of time. Making them supposedly safe and effective enough to use for months to treat chronic pain. But patients found themselves hooked and wanting more, and drug abusers found they could crush the tablets and snort or inject them, delivering the drug to the bloodstream much more quickly. Aggressive marketing and distribution pushed hundreds of millions of pills into communities. Then more and more addicts turned to cheaper alternatives, bought illegally, like heroin and fentanyl. An opioid medication developed to treat intense, end-of-life pain in cancer patients that was 50 to 100 times more powerful than morphine. It's a very complex epidemic that is nowhere close to being over, said Dr. Anshuchit, the C Disease Principal Deputy Director, in an interview earlier this year.